All right. Hello, everyone. Thank you for joining us today. Welcome to today's webinar, which is co-hosted by the World Health Organization and the International Diabetes Federation. Before we get started, we do have interpretation available today, so please make sure you are tuned in to the language channel of your preference. You can do so by selecting interpretation at the bottom of your Zoom screen. My name is Ida Ahmadpour, and I'm a member of the Global Diabetes Compact Team at WHO. I'm also a person living with type 1 diabetes since childhood. And for the first time publicly, I would like to share that I'm also a person living with diabetes-related complications. Tomorrow is World Diabetes Day, and today we are here to listen and learn from voices in the diabetes community, as well as hear updates and progress of our collective work on this very important global health priority. We also invite you today to share your reflections with us during the webinar through the chat function. Because we will hear from different perspectives today, and we know well that diabetes is a very diverse and difficult experience, we kindly ask that this be kept in mind when sharing your reflections with us in that format. So with that, I'm going to hand it over to our co-moderator for today, João.
Thank you, Ida. So my name is João Navais. I'm from Portugal. I'm one of the vice presidents of the International Diabetes Federation, and I would like to welcome you all to this webinar. I'm living with type 1 diabetes as well for the last, I think, 43 years or so. So it's been a challenge, and I'm very eager to listen to all of you. We are going to have, during this webinar, interactive polls. So we are launching now the first poll, and I would like for all of you to answer. I think you are already seeing the poll. You can take a few minutes now to fill in the poll with your answers. So we would like to know if it is in your country, it's morning, afternoon, or evening. And of course, if you are living with diabetes, where you are a carer, you are a healthcare professional, whatever. So please do fill in the poll. We are going to give you a 1 minute or two, just for interest of the time, before going to the first key message on the World Diabetes Day that will be given by Professor Akhtar Hussein. We are waiting for the results. And meanwhile, Ida and I have a few quotes of people living with diabetes from the community that we would like to share with you. For instance, you have one person from Nigeria that's living with diabetes. He's saying that my vision is that no youth should die of diabetes. And that's why we have a program which is Life for a Child. That is the motto of the Life for a Child. This no child should die of diabetes. Thank you for filling in the pool. So we need to move on. The first video that we're going to have is from Professor Hussein. He is the president of the International Diabetes Federation. He has over 25 years experience in diabetes research and education. And he is originally from Bangladesh and currently lives in Norway, where he is a professor at the North University.
Hello, I'm Professor Akhtar Hussein, President of the International Diabetes Federation. I will talk a little about this year's World Diabetes Day. The World Diabetes Day is the largest diabetes awareness campaign. It is marked every year on the 14th of November during what is now widely recognized as Diabetes Awareness Month. The day was launched by the International Diabetes Federation and WHO in 1991. The date was chosen to mark the birthday of Sir Frederick Banting, who had been born 100 years earlier in 1891. World Diabetes Day became an official United Nations Day in 2006 after the passage of UN Resolution 61-225. The blue circle logo was first used as a logo for the Unite for Diabetes campaign that secured the resolution. The campaign is in the final year of a 3-year theme around the access to care. The theme was chosen to coincide with the centenary of insulin, launch of the WHO Diabetes Compact. 100 years after the discovery of therapeutic insulin, we ask when the fundamental components of diabetes care would be accessible to all those who need it. In the second year, we concentrated on access to diabetes education for people living with diabetes and for the healthcare professionals who support their care. In this year, the last year of 3 years campaign, the focus is on primary and secondary prevention. We have 3 key messages for our audience. For people at risk of type 2 diabetes, the message is that knowing your risk and what to do is important to support prevention, early diagnosis, and timely treatment. For people living with diabetes, we say that access to the correct information and best available medicine and the tools to support self-care is vital to delay or prevent complications. For healthcare professionals, we say that the access to sufficient training and resources is required to detect complications early and provide the best possible care. As a part of the campaign, we conducted a research among people living with diabetes, conducting 700 interviews in 7 countries listed here. What we found is 7 in 10 of the people with diabetes we surveyed were diagnosed with their condition as a result of experiencing a complication. 94% had experienced at least one diabetes-related complication. Nearly 1 in 5 did not receive any information about diabetes-related complications during the routine healthcare appointments. More than half of those we surveyed said they worried most days about developing diabetes-related complications. 63% indicated that the fear of developing diabetes-related complications affected their well-being. 84% of respondents felt they could have done more to prevent their complications. And 62% felt that their healthcare providers could have done more to help prevent their complications. So, how can we get you involved? You can support our calls to action. We have 2 calls to action. We are driving people to access their risk of type 2 diabetes through our Test to Prevent tool. And we are asking people to generate a letter to ask decision makers to dedicate more human and financial resources to help achieve the World Health Organization diabetes coverage targets by 2030. Please visit the World Diabetes Day website to add any activities that you undertake to make the day to our activity map of the IDF. Please follow the campaign on IDF channels and use the World Diabetes Day hashtag or tag us at IntDiabetesFed. I hope you all have a successful Diabetes Day. Thanking you all.
I think what it is about dealing with this disease is that it takes a lot of support. The people who support you, who you can talk to, who you can learn from. This is peer-oriented, really makes a huge difference.
The advice I have for other people living with diabetes that has complication is that prevention is actually better than cure.
Yo le diría que se cuide, que no le vaya a pasar lo que a mí me pasó.
Considero que el apoyo que yo les doy a mis pacientes desde el inicio es la educación. Los recursos son limitados, ya que no contamos con una guía específica para poder brindarle a los pacientes y que ellos puedan tener conocimiento específico sobre todas las complicaciones que trae la diabetes.
I think for me, I'd put on a lot of weight. So I think
just being able to lose a lot of weight has just given me that energy back so I can keep up with my young kids.
My personal advice to everybody is to take care of your kidney health, eye health, then foot health and cardio health, which may arise out of the diabetic complications.
Thank you so much. All right, next, I'm very, very pleased to introduce Dr. Bente Mikkelsen, who is the Director of Non-Communicable Diseases at WHO, and her current focus is on achieving the Sustainable Development Goals through the reduction of premature deaths from NCDs, and also working with multi-stakeholders both within and beyond the health sector. And Dr. Mikkelsen is going to share with us WHO's progress towards 2030. Welcome, Bente. The floor is yours.
Thank you very much, Ida, and welcome to all of you. And I'm so pleased to see so many people online. And thank you for joining us. It means a lot that we are in this together. And happy World Diabetes Day. And I will, of course, like to thank the International Diabetes Federation and President Akhtar Hussain for your partnership and commitment to addressing this global health priority. Without you, it would not have been possible. And I want to acknowledge all of you, our speakers today, and recognize the diabetes community for sharing your voices with us. Unfortunately, I have to break the bad news. Diabetes is on the rise. At the same time, many people with diabetes remain undiagnosed. People who are unaware that they are living with diabetes is, of course, at the greatest risk of debilitating complications, as we saw in the video, that can be prevented through diagnosis and proper disease management. Diabetes is the only of the four main non-communicable diseases where premature mortality is on the rise, meaning dying before the year of 70. So we need to act on this together. That's why the Global Diabetes Compact was launched in 2021, along with the Government of Canada on the 100-year anniversary of the discovery of insulin. The compact was launched because business as usual is no longer an option, and we want and need all hands on deck to work on a common vision. We also know that the promise that Professor Banting and his colleagues did to the world, insulin for free, had not come true yet, even though the innovation. So the WHO Global Diabetes Compact has the vision of reducing the risk of diabetes and ensuring that all people who are diagnosed with diabetes have access to equitable, comprehensive, affordable, and quality treatment and care. The work undertaken as part of the compact will also support the prevention of type 2 diabetes from obesity, unhealthy diet, and physical inactivity. In order to obtain this objective, the Global Diabetes Compact works towards 6 areas of work. So we focus on access to essential medicines and health technologies. We produce technical guidance and products to support member states. We work on prevention, health promotion, health literacy. Very importantly, we work together with the regional offices of WHO in the country offices with all partners to have country support and country impact. We also stimulate and work on research and innovation, and we have set up a very interesting governance strategy and partnership structure, which many of you know through the Global Diabetes Compact Forum. In just 2 years, we have seen great progress. Some of our achievements include adoption of the first ever global coverage targets for diabetes at the 75th World Health Assembly. Also launch of initiatives by WHO regional offices supporting the regionalization of the compact. National spotlights meetings on diabetes in Uganda and Ghana, co-hosted by the Ministry of Health and WHO. and very importantly, the national targets for diabetes and hypertension treatment coverage and control set by member states in global and also in Southeast Asia region, and pre-qualification of human insulins. We have also coalesced over 100 non-state actors, including non-governmental organizations, academic institutions, and philanthropic foundations through the compact. And many of the stakeholders being online here today is already members. But please, if you are not a member, I'm sure that James will post in the chat how you can become a member. We have also established a technical advisory group for diabetes, which contains experts from all WHO regions. We have consulted with people living with diabetes directly through multiple focus groups, and this engagement mechanism is really the most valuable of the compact. Recently, announcements have been made at the World Health Assembly as well as in the UNGA to transfer technology that can build capacity and locally produce insulin in 2 different African countries, Egypt and South Africa. Meanwhile, WHO commitments to strengthen primary health care intervention continues. Access to primary health care is essential for people with diabetes. WHO advocates that every country prioritize access to primary health care and have developed technical packages, both hard C and pen technical packages, and I'm sure we will post them as well on the chat to provide guidance of diabetes care in primary health care settings. We still need all hands on deck to achieve the vision that all people who are diagnosed with diabetes have care that they need, that is equitable, comprehensive, affordable, and with quality. It is important to emphasize that UHD is critical to reach this goal, but we can all play a role here. So the Global Diabetes Compact continues to engage and learn from our stakeholders. One person recently shared their vision for a world for people with diabetes. They said, "I hope that people with diabetes around the world can live their best lives happily and healthy with access to the tools they need to thrive with the condition and not letting their diabetes stand in the way of their goals and dreams." WHO supports this vision and call on all of you to join us to continue to work together and to make this a reality. Thank you all for celebrating World Diabetes Day with us, and thank you very much for organizing this webinar. Thank you very much. Back to you, Ida.
Thank you, Bente. Thank you so much for being here and for your important words, and I'm going to hand it over to João for the next segment of the event. Thank you.
Thank you, Bente, for your kind words. It's for the International Diabetes Federation. It's a pleasure to work with the WHO, of course, and we truly believe that together we can achieve more. And in fact, we need to prove that when well treated, diabetes is not a barrier in our lives. So this is one of the mottos that we are aiming for. So it's not time to introduce the pool number 2. So you are going to have a few more minutes to fill in the next pool. So you are already seeing the pool on our screen. So the first question, if you have heard about the global coverage targets for diabetes, as you can see here, again, you should fill in if your organization is part of the World Global Diabetes Compact Forum, as Bente was mentioned before, and also if you are organizing World Diabetes Days activities this year, and if you are using the IDF resources for these year activities. Ida, can you share a few more sentences while I'm going to see the results of the pool to introduce the results, please?
Yes, absolutely. So for our audience, we have asked the global diabetes community to share their vision with us for a world with people with diabetes. And we received so many visions, and what was really telling about them was that there's so much commonality in what people hope for people with diabetes around the world. And one in particular was from a person living with diabetes from South Africa. And they shared with us that their vision is a world where individuals with diabetes can lead fulfilling lives, where they are supported by a healthcare system that prioritizes their well-being and fosters a sense of community and awareness. And I think that's something we could all agree upon.
And now I have the results of the first question. So I would say that in half of the people have heard about the global coverage targets for diabetes, and also more or less half of the participants answered yes to the question about the WHO Global Diabetes Compact Forum. And on the last bit, I think half of the people already are engaged on World Diabetes Days activities this year. I don't have yet the results of the last question, but yeah, we can move on to the next video, and I can share the results on when we launch the third pool. So it's my pleasure to introduce the next video, which is from Fatih Mohamed. Fatih Mohamed is an IDF young leader in diabetes from Maldives. He's a bachelor in human resources management, lives with type 1 diabetes, and will let us know about the power of informed communities.
First, I would like to thank advocacy team for giving me this opportunity to share my story. Thank you. So, my name is Fatih, and I've been living with diabetes for past 22 or more years. And to be honest, I don't really remember how I felt when I was diagnosed with diabetes, because I think I was way too young to express how I feel. But I remember being very scared of needles, but it was not a new thing for me because I see my brother taking his insulin shots regularly, and he's also type 1. And in my family, there are 3 people, including me, with type 1 diabetes. And we grew up in small island, remote islands. Access to diabetes care, insulin, or any supplies is not available there. And I remember a lot of time my parents import from foreign countries, like neighboring countries, insulin supplies, insulin. Both my parents were teachers, so we traveled a lot from one island to another. And during that time, testing glucometers, insulin, or any needles or anything were not easily available. So we had to bring a lot of supplies from foreign countries, neighboring countries. And this was in the early 2000s, but I can say there are a lot of kids living in the islands even now who does not have proper access to insulin or testing kits. And I can't agree that I'm living in a fully informed society, but I can say that we are living in a partially informed society. We have had many challenges from the hospitals. Healthcare professionals do not have enough information about diabetes, and I have personally met so many type 1 diabetics discharged from the hospital without proper guidance. I have been volunteering in the Diabetes Society of Maldives for the past 12 years since I moved to the capital, and they have been helping people living with diabetes for the past 23 years continuously. And in 2018, government included insulin pens in the national insurance, and Maldives became one of the first countries to give insulin free of cost for people living with diabetes. However, none of the other supplies such as needles, strips, glucometers are not available. It's not covered in the insurance, but it is available, which is very expensive, and it is the pharmacists cannot supply them continuously. So until 2018, Diabetes Society has been supplying insulin pens to every type 1 diabetic in the Maldives. I was one of the few people lucky enough to start the insulin pump therapy. We struggle every other month to get our pump supplies. There is no consistency, and it is also a very monopolistic business in the Maldives. In April 2021, I met with the current Minister of Health. We discussed the challenges and difficulties people living with diabetes faces in the Maldives. This meeting actually resulted nothing, and I'm still waiting for a call back from them. I called the Maldives government and Ministry of Health to provide us with all the medical supplies to be easily accessible from all parts of the country and not only in the capital. And I believe we still can delay or avoid developing type 2 diabetes, get tested, know your risk, take early precautions, and exercise and stay healthy.
Thank you to Fatih for sharing his words with us and his experiences. And I know that for many of us, depending on where you are, some of that resonates quite well. And for some, it might not. But I think to hear from these voices is quite important. So we'll continue hearing from the diabetes community. And right now, I would like to introduce our next voice. Her name is Felissa DeRose from the United States of America. Felissa is an International Diabetes Federation Blue Circle voice, like Fatih, also an assistant professor of English literature, and also the founder of Black Diabetic Info. Felissa lives with latent autoimmune diabetes in adults, and she's going to share with us her experience being misdiagnosed with type 2 diabetes for many years. We'll hear from her now.
Hello, everyone. My name is Felissa DeRose. I am so excited to be here today. I'm the founder of Black Diabetic Info. I live by the motto, diagnose, not defeated. It is a joy and a pleasure to be here. I was diagnosed with latent autoimmune diabetes in adults 12 years ago, but unfortunately, I spent 8 of those years being misdiagnosed. At the time of my initial diagnosis, I was so confused. I was confused. I felt alone. I didn't have anyone in my contact list and my phone that had diabetes, so I didn't really understand what that meant. When I was discharged from the hospital after 6 days, I was discharged with insulin pens, but no needles. I had a blood glucose meter, but no strips. So at the time, I felt really ill-equipped to manage diabetes. Fast forward to getting my initial diagnosis, I actually wasn't allowed to leave the facility without seeing a diabetes educator to teach me about how to manage type 1 diabetes. So the difference was glaring when I was diagnosed with type 2 from when I was diagnosed with type 1. I think it is so important to honor the theme of World Diabetes Day, preventing and delaying complications, because when I was diagnosed with diabetes, I thought that complications were inevitable. Like, if you have diabetes, you are going to get an amputation. If you have diabetes, you are going to need dialysis, you are going to go blind. And in fact, at my diagnosis, I had retinopathy issues, I had blurred vision. It cleared up after 6 months, but I thought it was permanent. So I feel as though we need more education around things that can be preventable and also things that allow people with diabetes to live their best lives. I have been fortunate to travel the globe and live in 3 different countries. One of the things that I know for certain is that there are countries where the financial burden of managing diabetes is not heavy on the individual person. So my charge to my government of the United States of America is to relieve the financial burden. Managing diabetes is already tough emotionally, psychologically, spiritually, and all these other ways. And when you have that financial burden looming over you, it's really devastating. It means sometimes people have to decide between paying for diabetes supplies and their rent or their mortgage, paying for diabetes supplies and healthy food, paying for diabetes supplies and getting their car fixed, or getting a ticket for the train or transportation, these kinds of things. So that's my number one thing. Remove the financial burden of diabetes management, because there are countries throughout the world where they have done that, and I believe people are healthier for it.
Thank you to Felissa for a very powerful intervention and perspective. I think the financial burden of diabetes is something that is unfortunately quite universal in all of our experiences, regardless of where we are. And we thank Felissa for sharing her perspective with us. So now we're going to shift back to WHO. And we have, I'm not sure if anyone, the video is frozen for me. If we can get Rebecca's slides up, perfect. Thank you so much. Just a few days ago, the World Health Organization released the Tobacco Knowledge Summary on Diabetes. And so here to share more about this very important release is Rebecca Orshand. Rebecca works in the No Tobacco Unit in the Department of Health Promotion at WHO in Geneva. And her work primarily focuses on advocacy for tobacco control and stakeholder engagement. So welcome, Rebecca. The floor is yours.
Thank you very much, Ida, for the warm introduction. It's a pleasure to join this webinar in celebration of World Diabetes Day and for the opportunity to highlight an important issue, namely tobacco and diabetes. And I'm here to present our latest tobacco knowledge summary developed jointly with the International Diabetes Federation and the University of Newcastle, Australia. Next slide, please. So this report is the 7th in our series of WHO's tobacco knowledge summaries and has the intention to provide a concise summary of the most recent evidence of the link between tobacco and diabetes, with clear calls to actions specifically targeting health professionals and policymakers. And our goal with this publication is to advocate for improved prevention and management of type 2 diabetes and to ensure that populations are protected against the harms of tobacco. Next slide, please. So it's estimated that 537 million people are currently living with diabetes, and more than 95% of these cases are type 2 diabetes. Tobacco use is a well-known risk factor, but what is less known is that smoking increases the risk of developing type 2 diabetes by 30 to 40%. Smoking also increases the risk of developing diabetes-related health complications, including cardiovascular disease, kidney failure, delayed wound healing, and lower limb amputations. Research indicates that smoking has an influence on insulin resistance and the regulation of glucose production, a significant factor in the onset of type 2 diabetes. Quitting tobacco is therefore a crucial step in preventing and managing type 2 diabetes and reducing the risk of related health complications. Next slide, please. Thank you. There's also evidence indicating that e-cigarette use increases the risk of developing type 2 diabetes. However, more research is needed on this topic. Nevertheless, it's important to note that there is no safe level of tobacco use or exposure to tobacco smoke. So to support tobacco users on their quitting journey, the WHO recommends a suite of options, including behavioral support, such as chatbots, text messaging programs, and quit apps, along with nicotine replacement therapy, bupropion and varenicline to deal with tobacco dependence. And you can find more information in the WHO's quitting toolkit, which I will pop in the chat very shortly. Governments should also do their part in ensuring that all indoor public places, workplaces, and public transport are completely smoke-free, and that tobacco users have access to brief counseling and toll-free quit lines. Next slide, please. Health professionals play a key role in educating people living with type 2 diabetes of the harmful effects of tobacco use on glycemic status, as well as the many benefits of quitting tobacco use. And policymakers should implement effective tobacco control measures to protect the populations, and particularly the most vulnerable among us, against the exposure to tobacco smoke. So needless to say, the benefits of reducing tobacco are far-reaching, contributing to the prevention and management of type 2 diabetes, but also in achieving the Global Diabetes Compact targets and the UN Sustainable Development Goal 3.4 to ensure healthier lives and well-being for all. And the final slide, please. So thank you so much for your attention. This was a brief summary of our report, but please don't hesitate to get in touch for more information. I will add the link to the full publication in the chat along with the quitting toolkit. Thank you so much and happy World Diabetes Day, everyone.
Thank you, Rebecca, for bringing to the discussion such a relevant and important topic like tobacco use. You all know that tobacco is a risk factor, but it's quite interesting in a way to see the impact, the negative impact of tobacco on people living with diabetes, which is maybe not well known in all countries. We all know that the governments are doing their bit. They are putting barriers to the smoking in many places. We are in Portugal, we have always debates between people that do smoke and don't smoke, where people that wish to smoke, where they can smoke, but this is a different discussion. Bottom line, we should fight for a non-smoking environment in all places where you live and work, of course. It's my pleasure to introduce next video, which we are going to talk about experience on access to essential care by Jérôme Casabouillet. Sorry if I mispronounced your surname, Jérôme. Jérôme is an IDF Blue Circle voice from Burundi. He's a freelance journalist and a diabetes advocate, lives with type 2 diabetes, and will tell us more about access to essential diabetes care.
Hello everyone, my name is Jérôme Casabouillet. I am a Burundian refugee in Rwanda. I have been tested with type 2 diabetes in 2018. 5 years with diabetes is a long journey for me. For the first time, I was thinking that it was error from the healthcare center, and I verified with another the following day. I have searched refugees who are living with diabetes, and we have created a refugee diabetes club, which is under registration now as Refugee Diabetes Association. We help each other and advocate together, for refugees who are living with diabetes. And I have joined the Blue Cycle Voice, a campaign for IDF, and the Dog Voices, a campaign for the dog labs, to advocate for people who are living with type 2 diabetes all over the world. And as you know, COVID-19 has negatively impacted the access to essential care, because donors was focused about Ukraine war, and now they are focusing on the Palestine and Israel people, and they are forgetting the Africa and low-income countries. And now we are struggling. It is the reason why some are taking traditional medicines or automedication, because healthcare centers are poor and don't have equipment to help us. About preventing and delaying diabetes complication, which is the topic, healthcare centers don't have a professional who are specialized in diabetes care. Many people who live with diabetes are taking medicine as beans without more information about it. That can negatively impact the people who are living with diabetes, especially in Africa. Poor in Africa say the bad food are the food which are not sufficient. They say about quantity, not quality, or appropriate diet for people who are living with diabetes. Some are being a victim for ignorance of complications about diabetes. I ask government to improve life for people who are living with diabetes, to integrate the diabetes courses in classes, and to add medicines on the list of medicines which are covered by medical insurance. Thank you, everyone.
Right. Thank you so much to Jérôme for sharing that experience with us as well. And I know that many people joining today, we have quite a diverse group. We have people with diabetes, we have different diabetes advocacy organizations, but we also have policymakers who have joined us today. So for the policymakers and for those who are in positions of policymaking and decision-making around diabetes, there are requests for you specifically from the diabetes community that the International Diabetes Federation have put together. So for the next few minutes, we will hear from the community their specific requests for policymakers and for their governments on this World Diabetes Day.
World Diabetes Day means connecting with people with diabetes, being as a community to empower each other. In Indonesia, currently we're doing a project on women with diabetes that we believe that women play important roles in education, prevention, and empowering each other.
El Día Mundial de la Diabetes para nosotros es el mejor día del año para poder unir esfuerzos de las personas con diabetes y todas las personas que nos apoyan para concientizar sobre la diabetes. Y ustedes se podrán sorprender por qué nos celebramos, pues porque estamos con vida y buscamos mejorar nuestra calidad de vida gracias a este día.
Hi, I'm Tapi Semenya, and World Diabetes Day represents a crucial opportunity to raise global awareness, promote prevention, and support those living with diabetes in their journey towards better health and well-being.
Para mí, el Día Mundial de la Diabetes es una oportunidad para, primero que todo, agradecer el acceso que tenemos a la insulina, y si no tenemos el acceso a la insulina, crear iniciativas para ayudar a otras personas que no la tienen.
For me, November the 14th is a very important day in my life as someone living with diabetes, because this is the day that we set aside to commemorate people with diabetes worldwide and to discuss on various platforms about how we can make the lives of people with diabetes better.
La diabetes nos afecta más allá de nuestras fronteras a nivel global, y por eso para mí este Día Mundial de la Diabetes significa la oportunidad de extender nuestro mensaje de todo el año en concientización y en prevención tanto a la sociedad civil como a nuestros representantes.
Everybody, this is Dr. Kura Gomber, Associate Director for IDF World Diabetes. I want to urge you today on World Diabetes Day that no child or adult should die because of diabetes. We can make lives for everyone, even in the remotest of the places, equitable and accessible. Let's do this.
J'espère que vous allez bien. Depuis Guinée-Conakry. Je pense que la journée mondiale du diabète, c'est une journée d'éducation, de sensibilisation, mais également de dépistage pour permettre à toute personne atteinte de diabète ou non atteinte de diabète de connaître vraiment son statut sanitaire afin de mieux se prendre en charge.
The thing is, I'd like to see governments focus on the opportunity to provide universal health care and focus on not only one class or the other, but everyone.
November 14th. November 14th is the most important day in my life as a person living with type 2 diabetes. November 14th is the day my family, my friends, my community join me to celebrate diabetes. And it's since 5 years ago, 6 years now, but I'm wearing this 5 band because I joined the Blue Circle Voices, an initiative for the idea. So every November 14th, I put on a new band. I have 5 years, representing the 5 years I've spent with Blue Circle.
Right. It was quite powerful to listen to all of these testimonies about World Diabetes Day. In fact, it is a call to action to all policymakers that are listening to us and to all that are not listening to us, but to even to the diabetes community to do something for diabetes cause. It's my pleasure to introduce the next video. Christine Malouf is an IDF Blue Circle voice from Lebanon. She is a multilingual communication expert and creator of the Beirut Fitness blog. She's a carer for someone living with diabetes and will tell us about how to address the fear of diabetes complications, which are fear that I think happens in every single country of the world. And I've seen that quite often. I've seen that quite often in parents of the children living with diabetes.
Good morning, good afternoon, and good evening to everyone tuning in and watching us today. Thank you to the World Health Organization and the International Diabetes Federation for giving me this platform and this opportunity to speak as a diabetes advocate. My name is Christine Malouf, and I am from Lebanon. I was a teenager when my older sister Sylvie was diagnosed with type 1 diabetes. At the time, she was engaged and preparing for her wedding, so this came as a shock, not just to her, but to her fiancé, to my parents, and to my family as a whole. We had a fear of the unknown and knew little to nothing about diabetes. Through research and continuous education, we were empowered and were able to overcome this fear. And so my mother and sister overcame the fear by deciding to take action and building a patient advocacy organization in Lebanon called Dialeb. So I then grew up learning more and more about diabetes and seeing my mother and sister lead awareness campaigns and lectures in schools, municipalities, and the community in order to collectively raise awareness about diabetes, to know its complications, know its risks, and know how to prevent it. We all know that diabetes affects every home. And 90% of all cases of diabetes are type 2 diabetes, including my dad. And so that's why it is crucial that this year's World Diabetes Day theme is Know Your Risks, because the more we know about the disease, the more we know about diabetes, the more we are able to prevent it from happening and also prevent its complications. Knowledge is power in this case. And so I'd like to end but with a call to action to my government and to all governments around the world, because we know that for type 1 diabetes patients, insulin is life. They cannot live without insulin, and yet it continues to be inaccessible and unaffordable to so many people around the world, especially in Lebanon and in the region. And so I call on my government to take action to make insulin accessible and affordable to all, and implement awareness campaigns along with patient advocacy organizations in order to prevent the rise of type 2 diabetes. Thank you.
Thank you to Christine for sharing that experience and perspective with us. I think knowledge is power is something that we can all certainly rally around. And I wanted to just share another perspective from the community before we move on to the final poll and to our closing for today. These words were actually presented to us originally in the Spanish language, so I will read it in Spanish, and I apologize if it confuses our interpretation team at all, but I think it's very important to honor the language in which it was shared with us. La diabetes se presenta en todas las edades, todos los idiomas, todas las culturas y todas las razas. La información sobre diabetes también debería presentarse de la misma manera. And that is from an individual living with diabetes from the United States of America. So with that, we still want to know more about you. And I think because our theme this year is on risk reduction around complications, we acknowledge and understand that we know that people with diabetes can live long and healthy lives if they have access to essential care and treatment. And so our questions for this next poll are really around that. We want to know, do you have access to the resources you need, whether you are an individual with diabetes, whether you are a care provider or an organization? Is that available to you? And if it's not available to you, is there training that you need around that? So this is We welcome your input. Oh, we see the numbers are coming in. And it looks like a vast majority of you do have access to regular information about diabetes-related complications. It's a little over 70%, 65%. And for the healthcare professionals who are joining us today, results are still coming in, but probably about 50% of you have access to training to help people with diabetes management or prevent complications. So that's quite interesting. Thank you. Yeah, we'll give it another minute or so. And then Joao and I will move to the close. We do have a few minutes. I think this is a record in WHO, perhaps IDF history, that we are on time, which is thrilling. But if you do have any questions for us, please feel free to put your questions in the chat. And if we are able to, we'd love to answer them for you before we wrap up for today. So Joao, would you like to share your reflections and thoughts with us?
Yes, I'd like to do so. And I always switch to Portuguese, but I thought it would be fine to end up with Portuguese. Sorry to interpreters. And I'm warning you that I'm switching to Portuguese. Foi prazer estar aqui neste webinar com todos. Os temas que nós, obviamente, tocamos são muito importantes para diabetes, para as pessoas que vivem com diabetes. Nós temos de tornar um mundo melhor para as pessoas que vivem com diabetes, temos de tornar um mundo melhor para potenciar a prevenção da diabetes. A doutora Bente disse, e é verdade, a diabetes continua a crescer em todo lado. É muito difícil quebrar esta curva, mas não é por ser difícil que nós vamos baixar os braços e não vamos fazer nada. Antes, pelo contrário, nós temos que fazer mais, fazer melhor, para que, na realidade, a qualidade de vida das pessoas com diabetes seja melhor cada dia que passa. Foi falado aqui também no chat sobre a diabetes tipo 2, como se pode prevenir. É claro que ter um estilo de vida saudável, uma alimentação equilibrada, atividade física, não engordar, promovem a prevenção da diabetes tipo 2, mas nós sabemos que nem toda a diabetes tipo 2, nem todos os casos, são preveníveis. E também é um erro que se vê muitas vezes, no fundo, culpabilizar as pessoas que têm diabetes tipo 2 pela sua própria diabetes. Isso não é verdade e nós não devemos culpabilizar as pessoas por causa disso. Gostava de finalizar, antes de passar a palavra para a Aida, dizer feliz dia de diabetes, feliz Dia Mundial da Diabetes que se celebra amanhã, feliz Dia Mundial de todos nós, feliz Dia de Diabetes e agradecer à Organização Mundial da Saúde pela coorganização deste webinar. Aida, to you.
Obrigada, Joao. Thank you so much. And there's a few things that I heard today as common themes from our speakers. One, of course, from the lived experience perspective is the financial burden of diabetes, which unfortunately is just a persistent reality for many of us. The importance of universal health coverage, the importance of primary care when we think about diabetes long-term, and of course, the importance of access to essential care. So those were the things that I really connected with and found to be quite common in our sharings today. Of course, you know, with the community, for those of you who know me, I'm very passionate about integrating the voices of people with diabetes. And so I'd like to close with more words from the community. These are words from an individual with diabetes from Ghana. And the vision for them is a world with high quality access to diabetes care, technologies, and diabetes education, regardless of geographical location. And there were words from a person from England, which I thought was quite compelling. It was very simple, but the words were, I envision a world where diabetes can do no physical or emotional harm. And I thought that was very important to share with you as well. So before we say goodbye, I think we have a couple minutes to answer a question from the group. And one question in particular was around type 2 diabetes prevention. So I'm going to hand it over to Joao to answer that.
Well, I've pointed out already that because the prevention of type 2 diabetes is pretty much based on a healthy lifestyle. there are also the genetic factor that is featured into the developing type 2 diabetes. And I would like to, instead of answering more precisely the question, I would like to pick up what you were saying about mental health. Mental health in these days are a hot topic. Unfortunately, is becoming a hot topic, at least in Portugal, in many countries of the world because of COVID. And now, again, the access to diabetes care, access to insulin is a key element when we have wars all over the world. I mean, the wars are, of course, a nasty events, but for people living diabetes that do have to have access to insulin to live, it's, of course, something that is on top of everything that is surround them. So again, access to proper care, access to insulin, and also mental health is a key topic of today's, and I think over the next few months and years, and it will be a really, really hot topic.
Thank you, Joel. I think we will go ahead and wrap up. It's all right. So on my behalf, I would just like to say thank you for joining us. Please take care of yourselves, take care of each other, and happy World Diabetes Day. And please get in touch with us.
Yeah, and I would like to second that, Ida, and thank you, Ida, for co-hosting this event with me. It was me a pleasure.
Likewise. Thank you, everyone. Happy World Diabetes Day. We'll see you soon. Bye-bye.
Bye.